Hi everyone, welcome to your Portfolio of Evidence training session. I'm your assessor. Today I'm going to guide you step by step on how to complete your PoE using the PebblePad. You guys must have your PebblePad logins at the moment. This session is really important because your PoE is the key part for passing your qualification of NEBDN exam. By the end of this session, you should clearly understand what you need to do in the PebblePad and how you will do it properly. For the session overview, in this session, we are going to cover everything you need to know about your PoE. First of all, I will explain you about the portfolio of evidence, what it is actually. Then we will go through towards the structure of each unit so you would understand how it would work. And after that, we will focus on that, the most important part, that is your knowledge evidence and your performance evidence. You also have your reflections and your personal developmental plans that you will need to be use them as a performance evidence. After that, we will focus on about the how you will upload your files on the Atlas. Before you start your PoE, this is the most important thing you need to understand, and you need to do this step first, right? Before you even start your unit 1, there is a very important step that I have seen many students forget. You must first complete your learner details. It has your employment details, your portfolio, and the date you will going to be started. Okay. Later on I will show you the atlas and where this part is so you guys can fill out it first. This section, learner information section. In this section, you need to enter the details about your workplace. This includes your employer's name, full address, your working hours, and the type of patient you see. Are there NHS patients or are there private patients? You also need to mention any specialist treatment or your practices offering, like orthodontics. This will help your assessor to understand your working environment, in what kind of environment you are working and what kind of skills you are enhancing and what kind of experience you are getting. And this is also the most important thing, authenticity declaration. Here you are confirming that all the work you submit is your own. You are not taking any kind of help from others and using AI to complete it. You are not allowed to copy it, anything from the internet or anything from other students that have passed their exam. Also, if you use AI or any other source, you must need to clearly mention it. If you have used the GPT, if you had used any writing tools like Quiltboard for Grammarly, for anything, you need to mention it properly. At the end, you will sign digitally to confirm everything is true. Please take this step very seriously because if your work have any kind of plagiarism, then it can lead to failing your work. So, starting the main thing, what is your PoE? Your PoE is basically it's like a collection of evidence that shows your learning and development throughout this course. It is not just like you are writing exams or theory. It includes your knowledge, your clinical skills, and your professional behaviors. Then, same, the knowledge is not like the essays or assignments we do in masters or bachelors. These assignments are basically focused on the GDC guidelines. You have to to get the knowledge of all the references and all the skills out there. So you are not only showing that what you know, but also what you can actually do in a real dental settings. If we can say, this includes how you assist during procedures, how you communicate with patients, and how safely and professionally you work. If you get a patient that is scared, how you will deal it, right? So this is not only about what you know, it is more about what you know and how you will use this in your practical practice. Also, this is very important to understand your PoE is a requirement. Okay, this is a requirement to achieve your level 3 diploma. If your PoE is incomplete, it is not up to the standard and you will not be able to pass the exam. So you should take it seriously from the beginning and keep working on it regularly. Next, we will be moving towards the structure of units. Your each unit have 5 sections. First is the preparation, second one is knowledge evidence, third one is performance evidence, fourth one is reflection, and fifth is assessment. For you guys, you have to go through from structure of from 1 to 4. You have to fill your preparation. That is your before knowledge, the knowledge you have for that unit. And second one is the knowledge evidence. Third one, performance evidence. And after completing the performance evidence, you will review and assess is your information and knowledge is improved or not, right? This is a self-evaluation form. And last one is for your assessor, for me, for assessment to give you guys the feedback for each unit. Now we will be starting from the examples. We will take unit 1 As our example, in Unit 1, we have professional practice in dental setting. In this unit, you will develop your understanding of how to behave professionally in dental environment. This includes following rules, working ethically, and maintaining patient safety. You will also apply this knowledge in real situations. For example, like I have said before, how you communicate with patients, how you support the dentist, and how you handle different kind of situation professionally. You will need to provide evidence to show that you are actually doing these things in your practice, not just writing them in knowledge evidence. After completing the unit, you will reflect on your performance, what you did well, and what you need to improve. The main focus area in this unit are ethics, professionalism, patient care, communication, and understanding legal and regulatory requirements. Like these are the very important in your role as a dental nurse. Same way, each unit has specific sections, specific areas you will be working on. Now we will be moving towards the preparation section. This is the first section in every unit. It's again a self evaluation. You will evaluate yourself on the topic before moving towards the knowledge evidence. It basically says before you begin learning, you will rate your knowledge from level 1 to 5. This is your honest opinion about how much you already know about this topic, right? How much you know about the regulatory body working in NHS, right? So you will just rate your knowledge, but it's not just about like selecting a number. You also need to explain why you choose this specific rating for yourself. For example, we'll say like if you rate yourself low, you should explain what you don't understand. If you rate yourself higher, you should explain what you already know. The purpose of this is to help you track your progress. If in the start of the unit you have given yourself the rating of 2, and after completing the knowledge evidence and after completing the performance evidence, you see there is an improvement in your knowledge, then definitely in the reflection section you will rate yourself higher. And this is basically the aim of these units, to improve your knowledge and provide and give you guys a recall about how to apply them in your practice. Now I will provide you an overview of your atlas. This is the interface, and before going to start filling your units, you have to first fill your learner details, all the information. You cannot continue or even start any unit before filling this one. So now here in learner information, you have your employment start date, employer name and address, and after that, the portfolio start date. You have to mention all these things. After that, there is some details about the practice you are working, your hours per week, and any specialization that is offered by your practice, and what kind of patient you see. Are you seeing private patients or NHS patient? Again, this is the most important step. If you start filling your units before filling this one, your units will not be assessed by us. Okay, so first of all, you have to complete your learner information. After that, it has one more part, that is learner's declaration. And here you have to tick all these boxes. And on the last one, you have to sign this one. Okay, so as soon as you guys complete these two parts, you can continue and start filling your units. And I'll just give you a quick overview about all the parts we have already gone through in the presentation. This is how your unit looks. If we go towards the unit 1, there are these 5 sections. The first section is the preparation one. In this section, you will assess your prior knowledge about the topic, right? Again, as I told you about the rating you will give, you have to mention about the reason as well, why you have given yourself 4 or 5. After that, we have knowledge evidence. In this part, again, you guys have some questions right there. And if you guys go through these properly and complete all the sections that are required, then you can pass, sorry, you can pass your evidence like in the one go. Like in the question 1.1, there is describe the expectation and requirements set out by the GDC in relation to the practice of dental nursing. This section, this question required 4 parts. You have to address each one. First of one is the list the key regulations and guidance issued by the GDC. You have to mention about the GDC guidance and also about the does it has any particular name or any particular date, right? After that, you have the outline the ethical guidance and relevant laws, including principles of patient care and professional conduct. Here you again, you guys have to mention about the names of the laws and how they are applicable and where you guys can use this one. But again, you have to write it like an essay, not like you do or use these things in while you're working, right?
And after that, there is explain what systems and training are in place to ensure compliance with these expectations, describe the implication of the failing to adhere to the requirements and expectations. You have to fill all these questions as required and as mentioned. There are certain ranges and certain guidance for you. In this question, you have to mention about the Equality Act 2010, Human Rights Act 1998. You have to cover all these sections, all these ranges. These are the things as an assessor we will be looking toward. You all will add your files in these asset sections, and after that you have uploaded them. I'll review it from my side. So next part is performance evidence. This is the part where, as I have explained before, you guys have to have evidence. These evidence can be in the form of videos, audios, any pictures you have taken in the practice, but again, no patient information should be visible. Again, in this section, all the details are mentioned, like what kind of things as an assessor we will be looking towards. Here you have to add your answer, and after that you have to add at least two evidence for each question in all the units. Also remember one thing, while submitting your files, you have to give them proper names, right? Unit 1, 2.1 performance evidence. You have to mention proper names on the files. After that, here is your reflection part. You will reassess your knowledge after filling the knowledge evidence and performance evidence. And again, you have to give the justification why have you guys have rated yourself 4, 5, or 3. This is the last part you will be filling for your unit. And after that, there is the assessment part. And this is the part I will fill after assessing your answers. Here is the all PDPs, the personal developmental plans, reflective guidance, all unit reflections. You have to finish these as well after completing the each unit. There is the mandatory witness testimony, and this is also will be tracked after you will start filling your units. And this is all from my side. If there is any question, you can ask in the WhatsApp group and we will provide you the answers. Thank you.
Next, we will be moving towards the second part, that is knowledge evidence. But before we go towards the other sections about knowledge evidence, performance evidence, first we need to understand what are these basically. So most of the students basically confuse both of these sections. They add knowledge evidence in the performance evidence sections and mix up a lot of things here. So what we need to do, we need to just understand the difference between them. In knowledge evidence, this is all about what you know. This is the theory part. Your answer questions in PebblePads and you will explain the concepts. If I can give you an example, it would just like an course you did in your bachelor's or master's that has 3 credit hours, 2 credit hours in the theory and 1 credit hour in the practical, right? So this is the same style. In knowledge evidence, this is completely theory based. Here you don't need to mention about your personal experiences, right? Here you will only write about what you know. For example, explaining about infection control, you will be describing about GDC control, GDC standards, and then you will be writing about the safeguarding procedures, right? But here again, you will not tell about any situation you faced, not about your personal experiences. You will use all these things in your performance evidence. That is basically your practical based part. You show your skills in your workplace, right? For example, assisting during a dental procedure, setting up different instruments for different procedures, following cross infectional control steps, then getting feedbacks from your supervisor, right? These things are all those things you do in your practice. These are your practical part. So you will be needing them, using them in your performance evidence. If I can just say this in a simple way, it would be like knowledge evidence is again, it's only about what you know, right? Performance evidence is all about what you do. So now we will be moving towards your knowledge evidence. Again, I'll just repeat knowledge evidence is what you know. So in PebblePad, you will be given questions and you need to answer them properly. You must make sure your answer meets the criteria. It should cover all the parts of the question and it should show real understanding, not just copying or memorizing things. Like you don't need to copy paste things from Gemini or ChatGPT and just paste that. You need to have the real understanding. So now let me give you an example. If your question is explain cross infection control, starting from the preparation task, during this unit, you will be completing different types of tasks. You will attend teaching sessions either in class, online, or in your workplace. You will also complete assessments set by your provider. Anything important, another important part is that mandatory witness testimonies, right? These are completed by your workplace supervisor when they observe your skill in real situations. You will also need to plan and collect your performance evidence, which shows that what kind of work you are doing in your workplace. All of your evidence should clearly show that you are applying your knowledge, behaving professionally, and improving over the time, right? Your assessor will look for active participation, meaning you are engaged in learning, completing tasks properly, and submitting evidence that is clearly linked to the required criteria. Next is knowledge evidence. Now let's talk about the knowledge evidence, which is the theory part of your POE. In the PebblePad, you will be given questions and you need to answer them properly. You must make sure your answer meet the criteria, it cover all the parts of the question and shows real understanding. So if the question is explain cross infection control, your if I can give you an example of the weak answer, it would just stop at it stops the infection, right? Like the question is explain cross infection control and it just says it stops infection. Yeah, it does give us the sense like what's the purpose for cross infection control, but it doesn't explain the things, right? It doesn't say about the GGC regulation, patient safety criteria, and what laws are used here. So you need to properly mention these things. You can see here as well. The answer for that question would be infection control is essential in dental settings. The standard infection control precautions, we will mention about the PPE, gloves, masks, eye protection, right? And then we will also write about the guidelines, the established guidelines for the prevention, like Public Health England, HTM 01 to 05, and General Dental Council standards. This questions has all the parts required to pass the knowledge evidence. So again, your answer need to be very clear and it should cover all the parts and all the ranges given by the question. So if I would just give you a hint, each question would follow one model, that is work model, right? It's visual, auditory, read, and kinesthetic. To do well in knowledge evidence, you need to clearly, and in your words, write your answers. Always structure your answer properly. Don't just write one or two lines. Explain your points, right? Instead of writing like PPE is important, write PPE such gloves, mask, eye protection. It is used to prevent cross infection between patient and staff. You are definitely mentioned about like the PPE is important, but you are also giving the reason, right? You are also telling about the component it has. Now let's look at the work model, which helps you understand different ways of presenting your learning. In visual, you can draw a simple diagram showing the infection chain. Auditory, you can explain your answer through a voice recording, right? This is your written answer, the most common one. And the kinesthetic, this is the most powerful real life examples that you will be giving in your POE, in your performance evidence section. Next, we will be moving towards your performance evidence. This is the practical part, and this is the most important and a little bit tricky part. This is where you show that you actually do this kind of work in your practice. For example, observation. You assisted a dentist during a filling, passing instruments, keeping the area dry. You write about how you followed infection control procedures during the treatment. You take picture of your tray setup without showing the patient. This is the most important thing. You cannot show or share any kind of patient details. You take picture of the tray, your supervisor confirm that you performed well in your task. So instead of just saying, I know infection control, you are showing, I actually did this kind of work in real life. Your evidence should show your skills, your behavior, your professionalism in the real dental practice. Next, about the performance evidence steps. To complete performance evidence properly, you should follow these steps, right? First, learn the theory, understand what you are doing, and then choose how you will show your work. You need to discuss this with your assessor. We will guide you how you can collect your evidence, and then you will finalize how you will show your work, like in a photo, report, or observation. And finally, you will upload everything in the PebblePad. Now let's look at a simple example of cross-infection control again. You take a photo of your clean setup tray. You write a short explanation of PPE used and you explain what steps you followed. This makes your evidence strong. You have given the theory part, you have shown the practical part by giving the picture, right? So these all points are covered. Your work must be valid, authentic, sufficient, and current. It matches the topic. It is in your own words. You explain properly, and it is recent. Just the most important one. So, as an assessor, we will look at your work. Is it real? It is clearly explained. It is linked to the criteria. Like we want to see that you are actually applying what you learned in the classes. The next part is your reflection section. After completing the POE, this is again a self evaluation. That it's like the same thing we did in the start in the preparation phase. You have rated your knowledge against a scale of 1 to 5, and here you will do this thing again, but again you will not have to give yourself just a number. You must explain why are you like why your rating has changed from the preparation. Then you need to reflect on your experience. This means thinking about what you did, what you learned, and how you improved. You should always include three things: your strength, what you did well; your weakness, what you found difficult; your improvements, what you did to get better. Now, let me give you an simple example. Strength: I become more confident when speaking to patients. The weakness might be I was slow when preparing the instrument at the start. Improvement: I practiced pre setup daily and improved my speed. A common mistake students make in writing very basic lines like I learned a lot. This is not enough. Your reflection should clearly show your learning and development. And your reflection is again, this is not just a task, it actually helps you grow as a professional. It helps you improve your clinical skills, your communication, your confidence in real situations. If you made a mistake during a procedure but you learned from it, this is a valuable reflection. It also helps you develop professional judgment, meaning you start thinking like a dental nurse, not just as a student. And if you guys just ask, like, why does it matter? Because it will show me that you are aware of your own strengths, your weakness, and that you are improving over the time. You can complete your reflection in different formats: written, audio, or video. We will talk about it in what kind of format we will be using for it. Next one is PDP plan. This is your personal developmental plan. This is something you will be keep updating throughout your course. For each unit, you have a PDP plan. It will help you identify what you need to improve and how you are going to improve it. You should include what your weakness or gap is, your action, how you will improve it, how long it will take you to improve it, and again, what results you expect from it. Let's look at an example. If first we will be talking about the gap, we would say, I am not confident in patient communication. The action will be I will observe experienced staff and practice speaking to patients daily. And the outcome will be I will be become more confident in speaking with the patients. So again, a weak PTP would just say I need to improve communication. This is again not enough. You need to mention the gap, the action, and the outcome. A strong PDP clearly explain what you will do and how you will improve. Your assessor will check. So we will be checking about what your goals are. Are they realistic or not? And are you actually updating your PDP regularly or not? The assessment section, this section is completed by me. As your assessor, I will review all your work, your knowledge evidence, your performance evidence, your reflection, and your PDP. I will check if you have meet all the required criteria or not. Then I will give you the feedback. Will include what you did well, what you need to improve, and what you should do next. There are some very important rules you must follow throughout your POE. You must provide at least one piece of evidence for each criteria. For each question in your performance evidence, you must have one evidence. But more is, it's always better to have more than one. You must never include patient identifiable information, for example, their names or their personal details. All your work must be your own, no copying from friends or internet. Also, do not leave anything for the last minute. You should upload your evidence regularly. You should be going like first you will complete your unit 1, then I will give you the final feedback. After you get your unit 1 approved, then you will be going towards the unit 2. So it means if you keep all those things for the last few days, it won't help you. You can miss your exams if you won't be regularly updating your POE. And if I'll just conclude it, there are again those common mistakes: copying answer from others, writing very short or weak answers, forgetting to complete the reflection, uploading evidence but not linking to the criteria. Avoid these mistakes and you will stay on the right track. So, to finish, I just want to give you some simple advice to help you succeed. Start early, don't wait until the last minute. Stay consistent. Even your small progress every week makes a big difference on the last. And most importantly, if you are confused or unsure, ask questions. I'm here, our team is here, and we will answer your questions and query. And most importantly, remember your POE is not just an assignment, it shows your journey and growth as a professional dental nurse. If you take it seriously and stay organized, you will do it well.
Now moving towards your PDP plans and reflection plan, all you have to do is go to in each unit reflection, and here you can find the templates for each one. This is the template for unit reflection, and here is the template for PDP plan. You just have to click on this one and then your template will appear. You have to add the unit name here and fill out all the details. After that, you have to attach this evidence in the reflection part. Same goes with your PTP plans. This will look like this. You have to add all the details. Just carefully read these questions and see what basically they are asking. You have to mention about the appropriate date for the goal you will be achieving. And on the last one, you have to add your science and complete this form. Last thing left is the mandatory witness testimonies. All your witnesses in your practices will get a separate sign-in accounts and they will be filling the witness testimonials. And in this section, your part is about the MWT learner questions. These are the questions for from each unit you have to fill and attach here. Same as you will be doing in your units in the knowledge evidence part. Yes, this is all from your atlas section. And just moving forward, all you have to do is just carefully read your question, see in which section they lies. Is this from knowledge evidence? In knowledge evidence, all you have to do is write about what you know, and same goes towards your performance evidence. That is a practical part, and you have to mention what practical you have done in your practice. So this is all from my side. If there is any question left, all you have can you can just message on the WhatsApp group and we will be address those. Thank you.